Kirtan, over to you, Kirtan.
Good evening to all the respected dignitaries and our esteemed speaker, Dr. Madan Jayaraman sir, and all the participants who have joined us today for this informative seminar on scopes and career in regenerative medicine. I am Kirtan, a second year MBBS student from Tagore Medical College and RIT subcommittee of IMA-MSN, and it is a privilege for me to serve as the host for today's session on behalf of the Indian Medical Association Medical Students Network, Tamil Nadu State Branch. At the beginning, I would like to respectfully acknowledge the constant guidance and encouragement provided by the patrons of IMA Tamil Nadu State Branch. Dr. B. Sridhar Sir, State President IMA TNSB, Dr. P. Sengutuvan Sir, IMA Past President IMA TNSB, Dr. A. K. Ravikumar Sir, President elect 2026 IMA TNSB, Dr. N.R. Tyagarajan Sir, President elect 2027 IMA TNSB, Dr. M. Thiraviam Mohan Sir, State General Secretary IMA TNSB, Dr. D. Solomon Jaya Sir, State Finance Secretary IMA TNSB. I would also like to convey my sincere regards to our state leadership team. Dr. R. Annamalai Sir, Chairman IMA-MSN TNSB, Dr. S. Jamunarani Ma'am, Co-Chairman IMA-MSN TNSB, Dr. V.S. Hariharan Sir, Chairman IMA-JDN TNSB, Dr. Kannan Rajendran Sir, Convener IMA-MSN Subcommittee. And a special appreciation to the state team members who continuously support the activities of Medical Students Network. Arunagiri Sir, Convener IMA-MSN TNSB, Ajay Karthik Sir, General Secretary IMA-MSN TNSB, Bala Hariharan Sir, Co-Convener IMA-MSN TNSB, Hariram Sir, Co-Convener IMA-MSN TNSB. Now, regenerative medicine represents a paradigm shift in healthcare by moving beyond symptom management towards the actual repair, replacement, or restoration of damaged cells, tissues, and organs. By integrating cell therapy, tissue engineering, and gene modulation, this multidisciplinary field harnesses the body's innate biological potential to solve the root causes of chronic conditions like heart diseases, diabetes, and neurodegenerative disorders. Its importance lies in its potential to provide permanent cures, alleviate the global organ donor shortage through bioengineered tissues, and reduce the long term economic burden of chronic care, ultimately offering a personalized approach to medicine that significantly enhances the patient's quality of life. Now, it is my distinct honor to introduce a visionary who stands at the intersection of clinical excellence and groundbreaking research, Dr. Madan Jayaraman, sir. He is a powerhouse of academic and clinical achievement. He holds an MS in orthopedics along with dual PhDs, one in stem cell and regenerative medicine and another in orthopedics. His credentials are further bolstered by an incredible array of international fellowships and DABRM from the USA. However, his impact extends far beyond the clinic. Dr. Madan Jayaraman sir is recognized globally as one of the top 2% scientists in the world, a prestigious distinction curated by the Stanford University and Elsevier. With a staggering 460 plus scientific publications to his name, he is a leading mind shaping the future of global healthcare. Beyond his research and accolades, Dr. Madan Jayaraman sir is known by his peers and students as an amazing teacher and a dedicated mentor. His passion for medical education and his commitment to pushing the boundaries of regenerative medicine make him the perfect guide for today's discussion. Sir, we are truly privileged to have you with us, sir. We look forward to learning from your vast experience. Please join me in welcoming Dr. Madan Jayaraman, sir. Over to you, sir.
Thank you, Ketan. So let me start today's discussion of what is regenerative medicine, what an undergraduate should know, how they have to proceed with regenerative medicine in India and over globe. So let me share my PPT. Give me a second. ஹலோ இந்த அது ஷேர் பண்ணிட்டு இருக்கேன்டா ஒரே நிமிஷம். ம்.
Now it's visible, sir.
Yeah, yeah. Okay, let's see sometime for on the what is the scope and career pathway of regenerative medicine in India. So basically, myself, I'm Madan. I have done my postgraduate in MS Orthopedics. Followed by MS Orthopedics, I did my PhD in regenerative medicine. Followed by PhD in orthopedics. So, what made me to read regenerative medicine? Because I studied in Stanley Medical College and as an undergraduate. During my time, I had an opportunity to visit regenerative medicine lab, which is there in Stanley Medical College, and the works what they have been doing since 2008. So over a period of time, I developed interest towards regenerative medicine because regenerative medicine is the paradigm shift which replaces the traditional drugs or medicines to replace something than to regenerate a tissue of interest. So with this connotation, let's go a little bit about regenerative medicine and which all departments uses and why undergraduates should know or to learn regenerative medicine as a fellowship. So regenerative medicine basically it repair or replace the tissue of interest. It uses stem cells, tissue engineered products, gene therapies, and biological active molecules for regenerating a tissue. The goal is to curb the disease permanently and replace the desired or diseased tendon or a tissue into a regenerative tissue. So why India is a crucible for in regenerative medicine? Because we do have lot of labs, lot of fellowships, lot of biotechnological startups. They do a little crosswork in the global landscape of regenerative medicine. So the pillars of progress in India, we do have a lot of scientific advancements and we have a good regulatory frameworks in India and the opportunities for each and everyone to become a global leader is affordable, scalable towards regenerative medicine therapies in India because we are the pioneers of regenerative medicine in clinical aspect. So what are the challenges we are seeing in regenerative medicine? One is stem cell tourism, where people come from abroad to India to get treatment done. Manufacturing gaps, we can take cells from the body as such and we can use it. Otherwise, we have to culture it. The funding valley, the critical valley of death, doesn't mean where the money lies in. Who helps you in the uh, undergoing the project? That is the critical valley of death. And finally, whether the patients are affordable or not in getting the treatment done. So this regenerative medicine spans across 12 disciplines, starting from orthopedics. Orthopedics, everyone knows after 40 years, everyone will come with knee joint pain or body pain. So the career pathway here is you have to undergo MS orthopedics, then you have to take regenerative medicine. Is this the right way? No. Even as an undergraduate, learning things and applying during your post graduation will make your pathway better. For example, now you are in undergraduation, pursuing a fellowship or a course on regenerative medicine as a whole. When you take orthopedics or dermatology or psychiatry or whatever it is, you can apply this regenerative medicine in your practice, do a thesis, and get exposed to various type of diseases where regenerative medicine can be used. The second subject is dermatology. Those who are aspiring to become a dermatologist or skin regeneration, hair regeneration, or whatever it is, or in regular dermatology, try to utilize the stem cell therapy to curb off the disease. This is particular fellowship to undergo. Radiology. Everyone will be thinking what a radiologist will do. Nowadays, radiology has boomed like interventional radiologists. So they'll be seeing the ultrasound guidance, injection or CT guided injections. To curb off the pain, they'll be looking into the CT guided injections at the point of interest. So this makes a radiologist from bedside, the bench to bedside, like from the lab, from the system to actual patient. So this is one such course where will help the radiologist to bring their knowledge into a clinical application. Next comes the microbiology. What does a microbiologist do? They always culture, they always do testing, blah 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 blah. Now, the career pathway has changed for microbiologists. Now, all the diseases which is evolving in the body is because of gut microbial dysbiosis. So, what bacteria has to be fed to a patient for the body to have a normal homeostasis? In this particular era, regenerative medicine and gut microbiome goes hand in hand. So, microbiologists also jumping into the field of regenerative medicine. Next comes biochemistry. Everyone thinks biochemistry is a subject where they only deal with lab. No. They also do sequencing, growth factor sequencing. They can modulate the growth factor and helps the growth factor to deliver as a drug delivery system, and they can check the metabolic analysis of the whole body. Next comes the pathology. Pathology everyone deals with histopathological slides, hematology, cytology, then forensic sciences. But how a routine pathologist can be deviated into regenerative medicine specialist? Here, they can check each and every part. Whatever we are trying to regenerate, they can check whether has it got regenerated in the biopsy. This plays a major role of a pathologist to become a regenerative medicine expert. Next comes gynecology. It's a vast field. Everyone thinks gynecology and obstetrics only delivery and hysterectomy. Beyond that, there are a lot of things: endometrial repair, ovarian rejuvenation, tissue engineering constructs. We do have IVF, in vitro fertilization, because of lot of stress levels are going up and up day by day. So in this particular era, where regenerative medicine can give a hope to patients, those who are infertile and those who are premature ovarian failure, when you give intra-ovarian injection, it produces follicles to the follicles. So regenerative medicine in gynecology plays a big vital role where everyone can delve into it to get the action out of it. Next comes ophthalmology. What will be there in ophthalmological diseases? There are so many diseases where we don't have any cure. That is called macular degeneration, age-related macular ARMD, age-related macular degeneration, retinal pigment epithelium transplantation, and macular hole, on ocular surface disorders. All these places, if you put some form of the other form, the stem cells, it will restore the vision. It will restore the limbal follicles and helps in the surface reconstruction. ENT. Nowadays, if a person is coming with vocal cord irritation, once you give intranasal or intraoral or intrathorax, in the throat, instillation of the stem cells will help the vocal cord to get it repaired by itself. Second one is hearing restoration. In hearing, we do have conductive hearing loss or sensory neural hearing loss. Instilling intratympanic membrane installation of PRP or stem cells will give rise to improved amount of sensory hearing loss. Next comes transfusion medicine. The 10th subject, which is jumping into regenerative medicine, is transfusion medicine, where they deal with blood and blood products. Here, the career pathway, you can either become a hematologist, do something with oncology, or take a U-turn, come to regenerative medicine, where you can be a part of the team which does regenerative medicine to the patients, where you'll be handling a lot of blood and blood products to isolate the correct PRP or the stem cells for the injections. Coming to plastic surgery, we do have complex reconstruction, scar revision, anti-aging treatment, and longevity treatment. Aesthetic treatment all comes under plastic surgery and dermatology, where you can leave all the flap repairs and move towards the less workload of aesthetics. Next comes podiatry. India is the diabetic capital of the world. So, 1 in 3 population of the diabetics must experience a wound in the foot. These are all non-healing long-term ulcers, which can be saved or which can be treated with minimal invasive modality like stem cells. So, how to achieve all these things? What should I do? All these subjects are different. I am just an undergraduate. How can I learn this fellowship before jumping into orthopedics or dermatology? Yes, we do offer a fellowship in stem cells and regenerative medicine from our Institute of Agatisha Institute of Stem Cell and Regenerative Medicine. So, myself, I am the course director for this particular course. We have academic leadership under 2 doctors, Dr. Ravichandran and Dr. Naveen Jeyaraman. And we do have program conveners, Dr. Arul Kumar and Dr. Satish Muthu. So, we group of 5 doctors are training fellows all over India for ethical and legal learning of regenerative medicine. So, this fellowship is run in collaboration with Brazil and US. From Brazil, it is Brazilian Institute of Regenerative Medicine. From US, it is Kansas Regenerative Medicine Center. So, who all can be eligible to apply? All medical specialists, MB undergraduate guys to the postgraduate or MCH or DMMCH guys. Everyone is eligible. The medical specialists like orthopedics, pain physician, dermatologists, plastic surgeons, women health in the form of obstetric gynecology, and research professionals, biotechnologists, biochemists, microbiologists, cell biologists, and as an undergraduate, yes, undergraduate of different years also can apply for this particular fellowship to learn things before jumping into the clinical field. So the core modules involves the foundations of regenerative science, techniques, how to prepare a good quality PRP to stem cells. Third one is the clinical applications. Fourth one, different cell types. Fifth one is therapies. What all therapy is good for which all diseases, in which stage of diseases. And the last one is innovation. Always think in terms of innovation, which helps you to propel further. And the other curriculum involves ethics, which plays a major role because these are all cell and cell based products. Last module will be research designs and methodology, where we'll be dealing a lot of clinical research. So, is the fellowship just training online or offline? Everyone do have a question. We do have an offline program for hands-on training in the form of PRP, PRF, BMAC, NanoFat, and SPF. All these therapies are clinically doable in the clinics. So these are all hands-on. We will be training you to become a perfect physician. Eligibility criteria: MBBS and postgraduates, everyone is eligible, and research experience of either 1 or 2 publications in your name. And we do offer only limited seats of 16 seats per batch. And we do have a bunch of renowned faculties over globe. Each and everyone do mention what I mentioned here is a renowned faculty of this particular area of interest. What they deal with is stem cells and regenerative medicine. Why this fellowship is needed? Because of medical legal clarity. Second one is scientific communication, and third one is patient protection. The program structure, it's a 12 months hybrid program, online sessions weekly once and offline session, 4 types of sessions. Each session spans for 2 days in every 3 months once, which is conducted only in our Chennai center. So during this course, one research project and publication is mandatory to get the certificate. The learning objectives in this particular course is knowledge acquisition as a whole, not only orthopedics, not only dermatology. As an undergraduate, you'll be learning each and everything as a whole of the subject. And the practical hands-on is we will be giving you, we'll hold your hands and take you forward from PRP till exosomes. And clinical integration, we help you to integrate how this particular PRP can be clinically integrated with the quality of outcomes. The core curriculum is foundations, the basic principles, technical skills, where each and everyone will be trained in what technique you have to prepare PRP and you have to give. And core science deals about regenerative medicine, which will helps to transform the basic science to the clinical aspect of the program. Last one is professional practice, with knowing the ethics and legal regulations and practicing ethically, legally is the only mantra for way forward in regenerative medicine. So the industries, how you can go in an industry, either you can do pharma or biomedical industry in the form of R&D or manufacturing commercializing product. In hospital and clinics, you can set up your own stem cell therapy labs and do cases. In research institutions, always go ahead with translational research, which gives you a good name. And someone who's super smart may go for biotech smart startup companies, where each and every company will be dealing with a small product, bringing into market, where the market will sell the product and give a good revenue. And the last one is academia. Academia involves only teaching and research, does not involve any commercial aspects. So the value of death, funding agencies, we do have DBT, DST. DBT is Department of Biotechnology, DST is Department of Science and Technology, ICMR and incubators in various programs, which gives you the funding opportunity for proceeding the further research. And yes, this always talks about the career advancement, that is certification. This certificate holds good when you match with USMLE or PLAB, and you will get to know a lot of doctors in this field and have a good networking opportunities, and the practice growth will be more when you practice regenerative medicine. The future outlook, yes, you have to get connected from India to UK to Russia, Russia to Americas, or America to Brazil, or Brazil back to China. You should have a good friendship and network all over the world, so that the practice of regenerative medicine is very easy across the world. So why I should learn regenerative medicine? In 2030, the market will be almost 50 billion plus, and the patient will be 1.4 billions. And India should stand as a top 5 countries which does all regenerative medicine therapies after learning regenerative medicine. So the advancements in this particular regenerative medicine is CAR T cell therapy, exosome therapy, 3D printing, and personalized medicine. All these things are coming right now in our way to, to escalate our fraternity in a higher way. Ethical consideration, we have to think about proper stem cell tourism and regulatory enforcement, and everyone should have a equal access and equity in getting the treatment done in India. Economic potential, what do you earn? You will earn more than what you are practicing right now. If you are a surgeon, more than that you will get in regenerative medicine. So you do have lot of indications in lot of the subjects. Try to grab the fellowship as a whole. You will be a pioneer in the world. So government initiative, government gives funds to do research, that is Department of Biotechnology, National Health Mission, and BIRAC grants also will be provided. The role of regulatory bodies, because this is cell and cell therapy, each and everything what you do needs a regulation which is already laid down. You have to follow the rules and regulations. Addressing the value of death, yes, public private partnership is very important to get the funds from CSR, that is corporate social responsibility, and you have to use it accordingly for your research. So this is an endless discovery in this field, and it has a paradigm shift from a regular treatment to a minimal invasive functional treatment. So building your career, it's a continuous learning, and always people think why we need to learn, because this is the era where if you learn all these things before taking any subject, this particular fellowship will guide you what exactly you have to do in that subject. For example, if you treat a knee joint osteoarthritis with tablets and medicines, it will take lifelong for the patient to be utilized on. But if you give one dose of stem cells, that will treat the disease almost 90%. So it is a good range of treatment when you think about regenerative medicine. So impact that you can make us cure the incurable. Whatever disease doesn't have any cure, that has a definite cure with regenerative medicine. And you can always save millions of patients' life, and you can become a leader over a globe. The power to heal, the future is only regenerative. So now I'll show what Agatisha family is. This is our family of international and national doctors who are all with us to treat, to teach, to treat, to guide everyone in the terms of regenerative medicine. And we had Italian faculties visiting our center in last year. They are also part of our regenerative medicine course. And these are the other faculties from over India. And this is particularly a patient who came all the way from US to me to get treatment in our Agatisha. He is a very happy patient, and we also conduct workshops. I'll just play a small video of my uh, institute's workshop. And these are our first and second batch students. We do have 3 batches right now. The third batch yet to come to us for the on-site clinical program. And this is our core team. And feel free to contact us by any of the means, either by through phone or through email, to reach out to us. What are the other scopes of regenerative medicine you will be able to know? And these are our Agatisha family. We do have Agatisha Ortho Stem Cell Clinic and Pain Clinic. We do have Agatisha Institute of Stem Cells and Regenerative Medicine. And the third one is Agatisha Regenerative Institute, Research Institute, that is ARI. So 3 verticals we do have. So that's it about our course. And as an undergraduate, what you will get out of this? You will be learning each and every aspect of regenerative medicine before getting into your clinical subject. That's the major chunk what you be able to learn here. Any doubts? Yeah, someone has asked, can we able to follow up during our UG classes? Yes, definitely you'll be able to learn things appropriately from us. And weekly once you'll be having one 1 hour lecture, followed by every 3 months once you are supposed to come to Chennai for 2 days, Saturday and Sunday, to learn the hands-on training which we are giving. And one other fellow, can we foresee regenerative medicine specialty 3D bioprinting as an alternative for prosthetics and support people who are amputated body parts? Yes, definitely, but it will take a long time for you to learn about 3D bioprinting, and you can do. Once you learn things from regenerative medicine, then you can add on whatever you want to do in your innovation, and you can help the people. One more fellow has asked, I'm a second year UG. Could you please explain the eligibility criteria and procedure for applying the fellowship? Yes, I have already posted the numbers and mail ID. I'll ask your representative or the group admin to post in your group regarding the brochure as well as the contact number to whom you can talk to for applying the fellowship. For osteoarthritis, cartilage graft is a permanent treatment. Yes, it is the permanent and a good solution if they come with the appropriate stage of the osteoarthritis. Yes, the scope of regenerative medicine in neurosurgery is also there, but basic fundamentals or whatever I have told, these all the things, if you learn things appropriately, then you can explore in neurosurgery as well. Guys, if you have any doubts, please post in this chat box. I'm happy to explain. If you have any doubts on joining this fellowship, how to proceed, whether you'll be able to do one publication or not, everything I'll be able to explain now. If you have any doubts, please do post here. Someone has asked, does any sir, does having many publication in our name influences the chances of selection into the team? No, my dear. Even if you don't have any publication also, we will consider taking you, because we'll be conducting an online interview and we'll be taking you if you are very much interested towards regenerative medicine, and we'll make sure that you'll be publishing one paper by end of your fellowship. Yes, I'll post the pre and post treatment pictures in the WhatsApp group where everyone is there. And we do have published data in our own motherland, so I'll be showing that data as well. Yes, being in final year, yes, you can take up the fellowship. This is just a part and parcel of your daily routine career. You can take and you can complete it even in the internship period too. Only very good thing is we do have a lot of good faculties who have done PhD in regenerative sciences after their post graduation, and we have pioneers in this field in our course, and we are the only body which has both North and South American uh, affiliations, and we are on the process of doing more affiliations for this course. Definitely this course will give a good insights for everyone in their clinical practice and career. Any other doubts? How to apply for the fellowship? Uh, Either the admin, group admin, please post the brochure in the group so that they will talk to the course coordinator and they can try applying the fellowship. But the seats are limited for only 16. Do we need prior approval from our university to apply? No, no need for any university approval. And I think I'm also there in the group. You can take my number from the group and you can text me, ping me personally, and you can get the responses accordingly. There is no need to take any special approval from any universities to join the fellowship. Any other doubts?
Even you can unmute yourself and ask doubts.
Would you recommend doing fellowship after PG or specialization or just after MBBS? During MBBS only you can start applying. You can do your, see, when you are doing your MBBS, if you do the course, it will be easy. It will be helping you to track which part of the subject you have to take a thesis in your post graduation, so that you will be applying this regenerative knowledge over there and you will get more and more patients and you will become a good leader too. And this is just an opportunity for you guys to learn the utmost cutting edge technology in one single roof in your country. Else, you have to go abroad to do it, which is a time taking and a lot of money it will be involved. But here it is very simple. We are offering it for 1 year, and you'll be learning all the cutting edge technologies, and we make sure that you'll be publishing a paper, and if you are interested you can do more studies with us. Sir, most regenerative therapies are still not fully approved in India. So, what should a student focus on today to be ready when the field opens up? Already the field is opened in India. India is the pioneer. We do have approvals for a lot of diseases for allogenic stem cells. And if you do autologous correctly, there won't be any problem in doing the stem cell therapy in your career. For an interventional radiologist, yes, you should be able to know how to prepare the cells before putting a guided injection in the place of interest. So this fellowship will guide you in uh, training yourself to play with the cells. Any doubts? Duration of fellowship is 1 year. When you come and learn in person, you will get more and more interest to know how these cells are being translated to become an organ. It is not a simple thing. It is a complex process which will we will make you to learn in a simpler way. Someone has asked only 16 per team. What about others, sir? Even if we have interest but still get rejected. Don't worry, we will be opening multiple batches. You will be, if you are in the first 16, no worries. If you are in the second 16, we'll be starting the batches very soon. We do have approvals for 4 batches in a year. So we have you have a fair chance of getting inside the fellowship. Is it advisable to join during 4th year? Yes, it is damn advisable. It is very easy for you to learn right now. Someone has asked, I have no publication in my name. So will I be eligible? Yes, you are eligible. We will make sure that we will hold your hand to do the project. So I consider if there is no doubts, we'll wind up the session, this brainstorming session, or you can contact our backend office, like our admin office. I'll ask your admin to post the admin office number and the mail ID. You can contact them as well to get the timely updates. The next batch will be starting from May 2nd week or 3rd week. So see you soon, guys. Thank you.
Thank you so much, sir. Thank you so much for this wonderful session, sir. It is one thing to read about a scientist who is in the top 2%, but it is another thing entirely to experience your passion for teaching firsthand. You have given us a vision for what our careers could look like, sir. You have made the complex world of regenerative medicine feel not just understandable, but like something we can actually aspire to be part of. We are so grateful for this session, sir. Thank you so much.
Thank you, Ketan. Thank you.
Thank you so much, sir.
The recording has stopped.